Before we go on to the final stage of thematic analysis, interpreting your data, I'm just going to go through some health warnings around how you use qualitative data to inform your evaluation. These come from quotations used in the analysis I conducted for a paper on the topic of patient safety. Okay, firstly then, does this quote represent the interviewee's views? This pharmacist is talking about the importance of having a good representation of different professional groups at clinical governance meetings, which all sounds reasonable. Then, however, the pharmacist goes on to say how in their view, this unfortunately was not happening. The message here is that it is important when quoting stakeholders that you faithfully represent what they are saying to you. On the whole, I'm not a fan of short, snappy quotations. If you use lengthy quotes for your evaluation, the context in which the interviewee stated what they did should be clear, and this makes it easier for the reader to judge the evidence on which your findings are based. Health warning 2. Are different stakeholder groups represented adequately in your findings? What might be a limitation of these quotations from hospital pharmacists? The pharmacists are speaking on behalf of another professional group, doctors. The pharmacists say surgeons don't look at the drug charts on ward rounds. Some doctors are frosty. But what do the doctors themselves have to say? It's fine to present people's views, but try to qualify these by also speaking to the professional group that the views expressed are about. Try to quote straight from the horse's mouth. Finally, how representative of a group's views is any one interviewee? The first quote from an interview makes the culture of safety within the pharmacy department sound strong, with training and reinforcement of messages, with guidelines in the loos, for example. However, I also observed a departmental meeting at the hospital that gave me a slightly different impression. As this field observation states, we heard dissenting voices reporting that pharmacy resources were under review and cuts to some services were threatened. This example highlights the value of using different qualitative methods in combination. As we discussed earlier, in terms of the use of observational methods, if you observe practices, so what people actually do, or compare what interviewees say with official policy documents, this can reveal important differences. Thinking back to evaluation politics, it might be that an interviewee has particular interests at stake when talking to you. So as a general rule, it is important to seek out multiple viewpoints in order to take account of this. The final stage of thematic analysis is interpretation and comparison. In terms of interpreting the quotations you have put into tables under different themes, you might want to look at the same theme across different cases. This could be different stakeholders interviewed, so sites, perhaps different service areas, or indeed regions if you're evaluating change across different healthcare systems. Or you could look at different themes within the same case. For instance, what stance does a particular interviewee have in relation to the range of themes you are considering? It is important to identify connections between the type of interviewee or stakeholder you have spoken to and the theme. You might find there is an association between a particular professional group and their attitudes towards this or that aspect of an intervention. Finally, I would recommend writing up your results as you go, describing the themes and the connections between them. For example, if you were looking at the theme of patient-centred care as well as equitable care, what might the connection be between them? Do they always go hand in hand, or could care that is delivered closer to some people's homes have a negative effect on others, because the city centre hospital was more convenient for that group than attending a clinic in the community? I find that writing early can highlight gaps in your data, indicating that you may need to conduct more interviews, generate unthought of connections, and help to dispel other interpretations.